Well, it was two organisations came together to help young people for different reasons. From the Prince's Trust perspective, we're looking for new opportunities for young people that are unemployed. From the NHS side, they were looking for young people that they couldn't normally attract to a career in the NHS, and they found that the Trust had young people that they couldn't find, and we had young people that were looking for a career. So the two actually came together perfectly.
The guys have been on a Get Into programme. Get Into programmes run for approximately 4 weeks generally, 2 weeks training, 2-week work placement. The idea is that we give young people the training they need and the experience to go on to apply to be successful in a job application.
Before I came onto Prince's Trust, I wasn't doing a lot. I was basically sitting at home on the internet, I was checking for jobs, and I was trying to get on as many volunteer projects as I could, and I needed to find something to do so that I can get a job.
I applied on the programme through the job centre, through my personal advisor Sue, and she recommended the programme to me, and I went through to the interview process and got on.
So the guys are currently on a Get Into Hospital Services programme. With that, they did 2 weeks customer services where they learnt about the way a hospital works, how to treat patients, confidentiality, and all other aspects of working within a hospital. From that, they went on to do 2 weeks work placement within the hospital. We've worked closely with Medirest, radiology, maintenance, and several other departments in and around the hospital.
The programme has changed my life, mainly because it's given me more confidence in my interview techniques, as well as writing a CV and getting on with other people in the workplace.
The new thing I learned, I was quite shy and didn't really speak to people that much, but from this course I've learned how to be more confident and speak to cause the thing I was doing was public, so I had to be confident in that, so my confidence has went up a lot.
The benefits that the course, the first 2 weeks classroom base, is to build their confidence, also to help them with their interview skills. It gives them qualification in literacy and numeracy.
Some, we would say, definitely come out feeling delighted that they've actually got their first qualification and feel that they are ready to go forward into a work experience placement, and hopefully from that they may gain work.
On my work experience, I was given a chance to do a few practical things with the people, which was like ATP swabbing, and I went round and I helped monitor and do some of the work with them, and I did quite a few pieces of photocopying as well, but other than that it was all good, and I saw a lot of what the people in the hospital do that aren't doctors and nurses.
All health organisations have a responsibility to ensure their workforce is representative of the local community, but also that they have the right supply of the workforce. And we know that without young people's skills, we would have significant workforce shortages.
The scheme has proved a very cost-effective way for trusts to have what is an enhanced recruitment process by taking approximately 12 young people per course and experiencing them for 4 weeks, both in the classroom to see how their customer skills can be developed and their confidence can be developed. This gives us a chance to see how well they can do in that respect. And then in the work placements too, it demonstrates to existing staff and managers that young people can play a role.
The plans that we have to make sure that the scheme is sustained in the future is to celebrate the good work that's been done here in this scheme and in other schemes. And essentially organisations that have taken part are already saying, when can we do our next one? Because they recognise that young people are hugely valued members of the workforce.
With all Get Intos that I run, I see a great improvement of the young people from start to finish. Some of them come to us and they've never been for a job interview before, some of them have never filled in an application, and some of them haven't had the experience that they really need, and to see them grow from start to finish is absolutely amazing. They leave knowing how to apply for a job, and we work with employers to feed them straight into those jobs, so the outcome for them is brilliant.
The course has given me more confidence in myself, some more qualifications which I didn't have before, and also a load of new friends.
Well, I want to be a nurse, so I thought if I get into the hospital I can gradually apply internally to become a nurse.
The one thing I take away from this course is gaining more confidence in myself and knowing I'm more capable than I think I was at the start.
For the future, I'm hoping to get into medical school at some point, and I do want to become a doctor.